actually do with the DEXA is we start by looking at the patient before weight loss, and as I've said, that allows us to make an estimate of where the dog or cat's perfect weight should be.
Yep.
We follow through the weight loss, and then when we've got to where we think their target is, we repeat the scan. And the beauty of doing that is, number one, it confirms that we've hit the perfect weight, the ideal weight that we wanted. It also means that we can compare the two and we can see what tissue is actually being lost. So ideally what we want them is to lose as much fat as possible, and not lose too much muscle mass or bone or anything like that. In reality, a little bit of the lean tissue is lost as well, but as long as it's minimal, we can be sure that we've made that major benefit. So that before and after for us is very important as well. On the screen here, we actually have one of our example cases. So this is one of our dogs, a Staffordshire Bull Terrier, before weight loss. So what you'll notice firstly is it's quite visual, and we do give the owner a picture of this. So this is essentially a composite of where the body fat and the lean tissue is. So we've got the patient lying on their back. What we can actually see here, if you look, there's a couple of dark shadows. This actually here is the chest, and the white little blob here is the heart. And one thing, again, I think owners find very helpful to sort of visualise is ultimately that's the chest, that's what the dog should be. Everything around here is extra tissue, that's all fat. Around the neck here, look how thick the neck is, that's all fat. And the abdomen is very, very swollen with fat as well. So the picture itself, I think it tells us something. Down here we have some numbers. We can look at total fat, lean, and this is bone mineral. We can also look in different regions if we want to. So overall, at this particular point, before weight loss, this dog basically had 48% body fat, considerably above what would be normal, so it would be 30% or below for perfect, we'd probably say. Okay, so that's before weight loss. Let's now look at the same patient after weight loss. So it's one we just did recently. So we can see straight away, the picture's a little bit bigger, but straight away now we can see this dog has shape. Yes, she's a Staffy, so they're going to be thick-necked and big anyway, and quite thick-chested, but you can just see straight away the difference here. And the fact that actually, if we put these two images side by side, the chest cavity is now more expanded because the dog can breathe a lot better, there's less body fat around here and less in the abdomen. So those, I think, are useful images. We can look at the numbers as well in order to be able to illustrate that.
Okay, and when you show the owners these, these dramatic images, what kind of reaction do they have?
I guess it can be very variable. I think the scan for us enables us to be very precise with what we do. For them, I think it sometimes is a major awareness about the scale of the problem. We do still have some that come to us in a referral clinic, a specialist clinic, not quite certain or not quite in agreement that there is a problem there. And sometimes when they see those images, it's enough to say, actually, yes, there is something here in place. So, some of them can be very emotional. Some it can just confirm what they know. For some, it can be an eye-opener there, and therefore a motivator. But it's a sensitive bit of information. You have to handle that conversation very carefully.
But then you also have the really rewarding after images as well, don't you?
Yes,
and that must be...
I think afterwards it's great, and we have these images, we have the numbers that help us to confirm where we should be, and of course we've got other photographs as well. But it's the whole journey they've been on, and I think for each individual that is successful, for many of them it's such a sort of positive experience to know that they've made that benefit. One of the things we stress is the fact that we never look backwards. So we don't look at when they first come to us, whose fault is this? Why did this happen? How could it possibly? It's not that. It's all about what we can make a difference. And I think these scans, to many of them, is essentially the culmination of that process, if that makes sense. And it's the reward. It's a big reward. Sometimes it's the biggest reward that they need to know that they've made a difference.
And this really is a state-of-the-art unit that you've got here, isn't it?
Yes, I think maybe we like to think that we've got the best facilities in the world. There's no one else that does what we do.
Yeah.
Which is the combination, I guess, of the equipment we've got, the time that we have available, and I guess the expertise we've built up over the 14 years we've been running.
Okay, thank you.